The following program is a Town of Colonie television production of the William K. Sanford Town Library.
I'm Mary Rozak, Director of Communications for Albany County. Welcome to Albany County News. In the next 30 minutes or so, we are going to be talking about health, mental health, and I think you'll find it not only very interesting but informative. Maybe you might perhaps benefit from this, or someone you know might benefit from the information we're going to share today. Joining me is the Director of the Albany County Department of Mental Health, Dr. Steve Giordano. Welcome.
Hello. Welcome. Yes, thank you very much. It's a pleasure to be back.
We have been together so many times recently, talking about all of the various things that the mental health is involved with. But we're going to start out talking about something that's been on every TV station and every newspaper, every radio talk show, and that has been the opioid epidemic. Mm-hmm. We've been talking about this probably for the better part of a year now, and a little bit longer, but I think the realization for many folks, it didn't hit a lot of folks, that this really is truly a crisis until, like I said, probably the last year. What do you, before we start talking about lawsuits and everything else, what do you see on a regular basis as an issue?
Well, we're lucky in Albany County. We are a provider-rich community. We have a lot of services, both that the county provides and programs that we work with in the community, our partners. And the ironic thing is that yes, this has peaked in the last year or so, but we've seen this coming for a number of years. Mm-hmm. And before the heroin epidemic, addiction was a problem in this country. Mm-hmm. And so from the standpoint of where I am, we've struggled with folks in our community for as long as I can remember with different types of addiction. But this is different. This is worse. It's striking communities that typically thought they were protected. Right. And it does have everyone's attention.
When you were thinking, drugs and addiction previously, I think that when we're talking about communities, we're talking about the suburbs, the bedroom communities that one would think, there isn't going to be a heroin issue.
That's absolutely right.
And what actually makes this different? Is it because when we talk opioids and opiates, mm-hmm. maybe not everyone understands. It's not just what people back in the 60s called horse. It's not just heroin.
It's not just heroin. It's complicated because there are prescription medications mm-hmm. that are opiate based. And as many people have talked about this before, there has been an overprescription of those medications. Mm-hmm. There's also been just the behavior over the decades of we're a pill-popping society. And so you combine that with the availability of these medications, you get people who become psychologically and physiologically addicted. Once their doctors catch on to this and they stop them from getting prescribed medication, the only alternative is to go to the street. And that's where people find heroin. As a matter of fact, 3 out of 4 current heroin users are reporting that they started with illicit use or legal use of prescription painkillers.
And that's astounding. I know that, I say the past year it's gotten a lot more attention, I think, probably in the media, et cetera. But as you said, it's been years in the making. And I know that the county executive, in his states of the county in years previous, probably as much as 2 to 3 years ago, originally instituted an opioid task force, yes. which was reinvigorated and has new responsibilities and a new role. You were a part of that.
I am. I'm county executive asked the health commissioner, Dr. Whalen, and myself to co-chair the task force. And you're right, we have had different iterations of it over the years, mm-hmm. But we brought in the past year community leaders together at the table in law enforcement, in behavioral health, which is my area, mental health and substance abuse, and in public health, which is Dr. Whalen's purview. And we believe that we're stronger working together than apart. And it's interesting when you put a lot of people in this community together in a room, you realize how rich a service community we are, because many of us don't even know that we're doing the same thing. And so we're trying to create linkages, we're trying to collect data, we're trying to share information, and there are some projects that we're working on together to try to put the brain power together to address this. People are dying, and I think that's what's catching everyone's attention. I was just reading the other day, they're dying in all the communities, as you were saying. In New York City, the Bronx historically used to be the epicenter of the heroin use. Well, the epicenter of the heroin epidemic is Staten Island. And it's just a different demographic. It's racially diverse. It's an equal opportunity employer. And I think that's what's catching everyone's attention. CDC is saying that over 90 people a day are dying in our country.
Do we have any figures for Albany County?
We do. We're working with the coroner's office. There's a lag, and we've talked about this before. The toxicology reports and the autopsies have a built-in lag. So real-time information, which is what we all crave, is hard to get. We're starting to see information for 2016, although there are still some pending autopsies, I'm told. About 35, 36 deaths last year that are directly attributed to heroin. Over the last 5 years, it looks like about 180 deaths, which takes small comfort in that. There are some counties in our state that are just on fire in terms of fatalities. One is too many.
Right.
And we also believe there's some underreporting and problems in reporting. The real number is the number of overdoses, and we're working on trying to work with our law enforcement partners to get that number, because the ERs are seeing this all day long, every day. And the testament to the fact that we're trying to get on top of this is perhaps that there's only 36 deaths. There were 63 reversals using Narcan last year.
And let's talk about that too, because it's been a couple of years now.
Yes.
That Albany County has been doing in partnership once a month, offering those free classes right at your building.
That's exactly right. Again, a partnership with the health department and the mental health department. We host Catholic Charities Project Safe Point, first Tuesday of every month, open to the public, and I invite everyone to come. It's a training in the use of Narcan, which is an overdose reversal drug. And the trainings that have happened in our building over the last couple of years, those folks are reporting that there have been 63 reversals as a result of those trainings. And they know that because when you administer Narcan, you need to go back to the trainer and hand in your old kit and get a new kit.
Okay, so there's only one dosage worth of whatever is in that
kit. Well,
there's
two in there.
Okay.
There's two in there, and they usually recommend that you give two.
Okay, so it's but one treatment's worth, I suppose.
Yes.
Okay.
Yes, and but what we're missing is the fact that every EMS rig and police agency, most of them are all carrying the EDs, and the hospital are using it. So the administrations are far greater, and that's a number we're trying to get at so that we could look at the magnitude of the problem. But it's nice to know that the people who have come to our trainings, and they're every month for a couple of years, have used and saved a life 63 times, at least.
I'm going to ask you something off the board, because we haven't talked about this, but I know that they're doing at the jail. They have a pilot program there. They
do. Yeah. Well, the sheriff is very active in this, and he has a lot of things going on with regard to the opiate epidemic. But one of the innovative things that we learned that he did was he created a pod at the jail for heroin addicts who were interested and willing to get some treatment, and working with the pharmaceutical company that sells Vivitrol, which is an anti-craving drug. They're actually administering a free dose of that medication upon discharge from the jail, hooking the people up into treatment in the community, and there's the hope that that will be another prong to the effort to kind of diminish the effects of this. He's doing a lot of other things. He's,
Sure.
you've seen his prevention bus and his,
Sure.
and of course interdiction is. This is why we brought law enforcement, public health, and behavioral health to the table, because everyone's got a piece of this. The interdiction efforts are very important. The drugs are coming in, they're cheap and they're available, and that's got to stop.
And one thing that has happened most recently, by the time folks see this this program, they certainly will have heard about the lawsuit that the county executive
Yes.
Has engaged in. County executive being not only the leader of Albany County, but he is the head of co-chairing a task force for the County Executives of America on this opioid epidemic, and bringing a lawsuit on a national scale with other counties across the country against pharmaceutical companies. Your thoughts in general, because we're not talking about just straight use, we are talking about prescription drugs.
Well, it's reminiscent of the tobacco lawsuits and the way that communities came together and really demanded from the tobacco companies information that had been hidden to the public before, and I think we're still getting money from the lawsuits.
Yes, we are.
Yeah. So it's a similar approach, and I think the evidence has slowly started to come out that pharmaceutical companies aggressively pushed painkillers. Dr. Whalen, I've heard say many times that physicians' practice changed as a result. Pain became a focal point of examinations. Reducing pain was a priority. We've all had situations where we've, had a sprain or a tooth removed or something where we got way too many pills, and many of us have them in our, closets. The problem is that, if your kids and their friends come over and they start taking 1 or 2 pills out of a bottle that has 90 that you haven't even remembered that you had, before you know it, those pills are getting diverted into illicit use. So I think the logic of the lawsuit, and I think it could be successful, is that we were misled. And the overprescription, which has been directly related to the illicit use and then the heroin use on the street, may very well have been caused from a culpability standpoint by some of the pharmaceutical companies. So it's very interesting, a lot of money at stake here, and I think communities could potentially use, if there was any recoupment, to fold that back into treatment and recovery efforts. So,
what are some of, if you don't mind sharing, what are some of those drugs that people may not even realize that they're taking an opiate? Are there some common names?
Well, the big ones I think are oxycodone and hydrocodone. Those are the
which
main
we're familiar with,
painkillers. But we're talking about, I remember having a dental procedure a year ago. I got a bottle of actually, it was a respiratory problem. I'm sorry. It was a bottle of codeine or cough medicine or whatever it was. But those are the kinds of things that they used to be over the counter. Now they're by prescription, but people have them. And you go to an emergency room with a sprain and you get 60 pain pills. You only needed 2. And now people are saying you might not even need them at all. You just need some Tylenol. We have every year there are take-back efforts and across the state, Albany County as well, where we encourage people to look in their cabinets and whatever medications that have expired or that they're not using, get rid of them, because the danger is to divert them. But I think hydrocodone, oxycodone, Demerol, Vicodin, there's a whole host of those.
So some of those and those derivatives, anything with some similar name is probably related.
And the ones that when you take them, it's like, oh, they work.
Sure.
And that's why they're so seductive. They work. They take the opiates and the opioids and heroin. They're narcotic analgesics. They take away physical pain. Addicts are attracted to the psychological side effects of that, which is the kind of cognitive, stress-reducing, peaceful feeling that comes from the use.
So let me ask you this, because of the way you're describing this.
Yeah.
So So someone is very much aware when they are probably becoming an, because they are aware of how it makes them feel, and they are, I mean, I like to accept responsibility for things, and it sounds like it's very similar to, when you've had maybe one too many drinks, and you're liking the way that feels, and someone says, I may have another glass of wine. You have that innate kind of, you have that feeling.
Well, I think you're absolutely right, and this is where I preface my remarks about saying addiction has been a problem for a long time before the quote-unquote heroin epidemic. This is what we struggle with: alcohol, marijuana, and cocaine, and all kinds of addiction. Years ago, I gave a talk where a parent asked, why do people do drugs? And the answer is simply, they work. They work. It's different for every person, though.
Sure.
For a depressed person, an anxious person, a distracted...
The thresholds are different for everybody. We only know that.
But when a person takes a drug that makes them feel better than they felt before they took it, they're going to take it again, and they can potentially abuse it if their life circumstances are in such. The
Pavlovian theory, right? I mean,
absolutely.
That's really what at work.
But with opiates, the danger is that's, and I've heard people say, well, some of these drugs will addict you the first time. I don't know that I believe that, but I think that the first time they're so seductive that you're probably going to take them again, and some of these drugs will get you physically addicted so quickly that you might as well say you were addicted the first time you took it, because you're not going to stop. And people don't understand that until they start to take more to get the same effect, which we know is tolerance. And then when they withdraw, they feel really bad. And then the shift happens. People start using to avoid feeling bad instead of the way they started, which was to feel good.
Is that what you're hearing when people are coming in? Do they recognize that, and they're right up front?
We recognize it when we talk to people, and it's pretty clear after a while that heroin is an example that's quite stark in this regard, because it does not feel good to withdraw from heroin, and people will do anything to get their next fix. And
so this is something that you cannot take care of yourself. You need to be in a facility or have rehab?
Once it gets started, you need professional help, almost always. I was just looking at some of our numbers locally before we came in. We have over 800 people in Albany County on methadone. Methadone is it's similar to heroin. It takes up the same spot in the neurotransmitter system in the brain, but it doesn't have the same intense addictive quality. So people they call methadone maintenance treatment. They get on methadone, they don't crave the heroin, and they can kind of go about their normal life. But do
they ever come off of methadone?
There are two approaches. One is methadone maintenance, and one is methadone to abstinence. Most people stay on methadone, though, for quite a long time. But that's just in terms of magnitude. There are 800 or so people on that, which means those were heroin opiate addicted people. In our outpatient clinics, we have about 1,000 people across all of our community partner programs and our own program. About 50% of those people, as of our talking today, are primary opiate addicts. So that's another 500.
So tell me, say that
800 on methadone.
Yeah.
500 in our outpatient services who are in the process of recovering from their addiction.
Okay.
And we have 140 or so residential treatment beds, and last I checked, about 50% of those folks were in there for heroin. So these are numbers we've never seen before. But one death is too many. But it's not just the deaths; it's the lives that are affected, and it's the families that are affected. We've gotten so many calls over the. We've always got these calls, but more so lately from family members. We don't know what to do with their folks. I know.
Well, and I'm sure. I mean, and treatment is not cheap.
Treatment's not cheap, but the public system of care, the Medicaid system, is very well adapted to serving these folks. We're trying to get to a place in Albany County where there's immediate access to services. And whenever I hear about waiting lists or people who are turned away, we try to get involved right away, because when someone's struggling with their drug use, abuse, or addiction, and they finally get to the moment when they say, I could use some help, that's not the time to say, give us a call in 72 hours or 3 weeks.
Sure.
Got to get them help today. So we're trying to do that wherever we can. And everyone needs a little bit different type of help, and we have a very wide array of services in Albany County. But half the battle is getting people to want to help.
Sure.
Sometimes their family members and loved ones want help for their loved ones more than their loved ones want help for themselves. And so it's all in a day's work.
I'm going to ask you in just a moment for the phone number for folks to call. I want to remind everyone that we are talking today with Dr. Stephen Giordano, the director of the Albany County Department of Mental Health. A phone number at Mental Health where someone can call to
Sure.
make that first step.
Well, I'd like to give you two numbers, because our general number is 447-4555, and that's the Mental Health Department, and we do a lot of different services. And if you're looking for mental health services in general, including addiction services, you can call there. And if we can't provide what you need, we will make sure that you get connected. The number that we are using for our addiction services is 447-4663, and that number will help you locate an addiction program that can address the needs. And we're also on the county webpage. There's a mental health page, and all of our services are listed there, with all the community services, with telephone numbers and contact.
Sure, always at albanycounty.com.
albanycounty.com.
So are there, when you're talking to me right now about families, obviously we know there is an impact.
Yes.
Are there support groups?
Yeah.
Are there, and sometimes people say support groups. I don't want to just go talk about this. I mean, what kind of support system might there be?
Well, we earlier this year, Mary, you and I talked about this before. We wrote a grant through the New York State Office of Alcoholism and Substance Abuse Services. We received $250,000 in Albany County, which we subcontracted to two of our local community partners. And one of them is for a position called the Family Navigator. And it was designed specifically with the help of the state to address what we were experiencing, which is the phones ringing all day long with mothers, fathers, wives, husbands, brothers, sisters. Don't know where to turn. So now we have one program. That telephone number is listed on our webpage. I don't have it with me, but it is a program devoted towards working with families. And it's not only to help family members get their loved ones to the right place, it's also to address the needs of those caregivers. And so there are a lot of support groups. The ones that always come to mind are the 12-step groups. Al-Anon was historically the group for family members of people who were struggling with alcohol addiction. But there are a number of support groups in the community. And I've heard the same thing. I don't want to sit around talking about these problems, but it's kind of miraculous when you are with people who are experiencing something similar to what you're experiencing, because right away it cuts out the poor me, I'm alone in this, no one else has it as bad as I do. And that support is very empowering.
Sure.
And it also creates creative solutions, because you'll tell me what you did and I didn't realize they could do that, and before you know it, people are getting the help they need. So the family piece is very important, and we're committed to making sure those folks are getting care as well.
Well, that psychological strain, I can only imagine.
Yeah,
When someone goes through.
and it goes on for many years. For addiction is one of the things, we're calling it a disease now. It's largely incurable. It's progressive. It's a chronic condition, but very much like other chronic physical conditions that people relapse, they get better, but it is something that can extend over the course of many years. So yes, it's a strain on the family as well as the individual who's using.
Sometimes you have people that'll still cluck and say addiction, disease. I don't buy it. Let me give you an example, and let's talk about very, very briefly what I think we would call fairly successful, and that's our tobacco cessation program.
Yes.
in Albany County. Very recently, there are some good numbers, the amount of people that have been
Yes.
helped.
Yeah, thank you very much for bringing that up. We just had a fourth annual event in honor of the folks that have taken the offer to get some help with this. We learned a number of years ago, again, a partnership with our colleagues at the Department of Health. We've been participating in the Great America Smokeout, and we've been, opening the doors to the mentally ill folks that we're serving to come in and get some information, resources. But in 2013, I learned that folks living with mental illness are disproportionately smoking. Their rates are disproportionately higher, and really painful was to learn that the quitting rates was way off of what the state averages were. So you and I don't smoke, I don't know if you do, but the non-mentally ill population is, their smoking habits are going like this. And for folks challenged with mental illness, it's like this. And we decided that this is, some people call low-hanging fruit. This is something we could save lives today.
Sure.
So we started 4 years ago to, in our mental health clinic, to work with folks who wanted to start to address their smoking. And we have evolved because we see now that folks that come to us, they're not unidimensional. They're not just living with schizophrenia. They also have diabetes, and they have hypertension, and they have all the other issues that all of us have.
Sure.
So our psychiatrists and our social workers and our nurses, we make that a part of our treatment. And so, yes, the numbers are quite, I think, encouraging. We've assessed about 900 people since we started this. Half of them are smokers, and quite a few of them, just in this past year, have embarked on trying to, reduce their use. Reduce their use or quit. The difficult thing in tracking this is that if you've known smokers, they're smoking yesterday, not tomorrow they're not, the next day they are. Say how many have quit? Well, we can only say, well, today, how many are working on it?
Well, addiction, it all goes back to addiction, and it's the same with alcohol. Sometimes there are many times before maybe someone is successful in an abstinence and that behavior. Addiction, the topic of today's program, and it certainly won't be the last time we talk about this, Dr. Giordano. I certainly hope that the next time that you come in, that we can talk about having moved the needle, so to speak, on opioid abuse. Thank you.
Yeah. Can I say one more thing?
Yep.
We take the approach that it's not us and them. It's not us healthy people treating those unhealthy people. They are us. 1 in 5 people, it's we. And so we all have been touched in our lives, either personally or indirectly, by mental illness and addiction. And that's the kind of culture that I've tried to develop in our services, and I know the people who work for us in Albany County are trying to embody. So yes, I hope we move the needle a little bit.
And I know how difficult that is. However, having not a smoker, but having seen people struggle with that.
Everyone's got something.
Types of addictions. My husband tells me I spend too much.
Well, there you go.
So on that happy note, Dr. Giordano, thank you. More information on any of the programs we talked about, or if you need help, certainly can be found at albanycounty.com. You can call 447-4555 for the Albany County Department of Mental Health. They can direct you with any area that you need help. I'm Mary Rozak. Thanks for joining us today for Albany County News. We'll see you again soon.